Hi, everyone, and welcome back to the Psychology Nook. I'm Sneha, the founder.
I'm Monali, co-founder of Psychology Nook. Welcome to the third episode of our video series, Let's Discuss. In this series, we invite people from different fields to discuss about mental health.
Today, we're going to be talking about the really stupid, ridiculous debate that is which one is better, the psychiatrist or the psychologist? So, as you all know, we both are psychologists, and what we do is we evaluate, we assess, and we help in therapeutic interventions when it comes to any mental disorder or any other mental health issue. Now, today's video is going to be about the role of a psychiatrist, then the role of the mental health team, then how can we enhance this mental health team? How can we understand each other better? And how can we work together for mental health awareness and for the patient primarily?
So today, our guest is Dr. Rahul Khemani. He's a consultant psychiatrist and in practice for more than 4 years. He's done DNB from Tamil Nadu and he's worked in different hospitals in and around Mumbai. He works with child, adult, and geriatric population, and he has special interest in child mental health, de-addiction, and psychotherapy. So let's just add him in.
Hi, Rahul, and welcome to the Psychology Nook. Thank you so much for being a part of our video series. And it's really refreshing to have a psychiatrist come on board and talk about these issues and these, topics so openly. So thank you so much.
Welcome,
It's
Rahul.
all my pleasure.
Yeah.
I'm very honored to be on one of the video series of Psychology Nook. I have been regularly getting myself updated on whatever y'all are posting, and it's really interesting and fun loving.
Thank you.
So, yes, I am happy to be on a talk where we need to understand each other better and work towards where we are headed, as everyone is in a confusion, in a turmoil, especially in this COVID situation where people are just looking up on Google, trying to search what is it exactly. So why not let's clarify it ourselves itself.
Definitely.
So now when we talk about clarification, in our intro, we mentioned the role of a psychologist because we're better equipped to talk about it. Could you tell us about the role of a psychiatrist?
Yes, this is one of the most common questions that people ask me when they come to consult me, that are you a psychologist or a psychiatrist? Like, we don't know what it is. So you all have already understood what a psychologist is and does. Over here, a psychiatrist is someone who has done a branch of he has studied medicine basically. So psychiatry is a branch of medicine, and you have to after your 12th standard get done with your MBBS, that is the basic med school that you go through. And after that you have to select the specialization of psychiatry, either ways, whether it's a diploma course or an MD course or a DNB course, and then finishing your 2 or 3 years into the specialization of psychiatry, you are finally called as a consultant psychiatrist, whether whichever place you're working at. After psychiatry also, there are many other courses available, the super specializations, whether it is in child psychiatry or geriatric psychiatry or de-addiction psychiatry. Again, that is a 3-year course, or there could be fellowships as well for 1 year. So these are basic bifurcations, but the basic concept is that a psychiatrist is a doctor who can prescribe you medicines primarily for any mental health disorders that a person is going through. And along with that, we have basic training in counseling and therapy as well, and we practice that in a day-to-day basis as well. Yes.
Yeah, so thank you so much for that in detail explanation. I don't think a lot of people knew about these different sectors where a psychiatrist does work, and in general the role. So now we've got this, like we've talked about that there's this one weird debate, which one is better, the psychologist or the psychiatrist? So in our opinion, it's ridiculous, and I think you think the same thing. So what are your thoughts about it?
See, I have always believed in the concept of a mental health umbrella. So over here, let me say what I mean by this word is that let's begin with the part first, that you need to realize the way mental health is being treated in the country. People do not even realize that there is a concept of a mental health. They realize that there is a body, you require a physical health, you need to exercise, you need to eat healthy. But what about your brain? What about your mind? Your mind also requires its own way of pampering and taken care of. So this part of the brain, the mind, is absolutely disregarded. And also, when there is a point where a person realizes that they're going through this and they need to consult somebody, unfortunately there is such a scarcity of mental health professionals. So I always call
Definitely.
all of us as a mental health professional. We are all an umbrella, where all of us come together, and the best that we can do is just at least be approachable for a person. There are so many places still in India where there is not even a single mental health professional available. And imagine, for those patients, they have to visit some other doctor who tries to treat them but won't be able to treat in the best way possible. And you for mental health is everything about your body. It even controls your own physical health as well. So if that is not getting taken care of, automatically nothing is going to be good. So I believe in the concept of a mental health team where, yes, as you already know, a psychiatrist and a psychologist are there, but along with them, there is a psychiatric social worker and also a psychiatric occupational therapist as well, where all of us together, when we work, we can provide the best treatment possible. And
Exactly.
Absolutely.
Yeah.
yes,
Yeah. So,
Absolutely.
can you share about some experience that you have where this all
yes,
these
in fact,
people come together and work and in the best benefit for the patient?
exactly. In fact, I'll share my own experience where when I was getting trained in my specialization for psychiatry, I remember that my institute had a separate complete section for a psychology department, a separate section for the occupational therapy department, and every patient who came inside the hospital was first seen by a psychiatric social worker who also works as a counselor and understands what the patient is going through. Then once they really figure out how the patient could be helped in a better way, they are ideally referred either to a psychologist, whether the patient requires therapy or counseling more in detail, and whether the patient requires more intensive medications and something in that regards. So then they refer to the psychiatrist, and once the psychiatrist or the psychologist has already seen the patient, then this patient we usually used to refer to the occupational therapy department, where occupational therapy is somewhat similar to how when a patient has a fracture and visits the orthopedic. So then automatically after you put up a cast and or either a cast or a crutch, what happens is that once you remove that, the mobility of that limb is a little restricted and you need to get the functioning back. So in
Mm-hmm.
this case, a physiotherapist is extremely essential. The same way occupational therapy works in the same manner, where it helps the person get rehabilitated into the real world. I believe
Right.
that this was the way patients would get treated. And on my personal experience, I had seen that all of the patients who were getting treated were having the best response possible.
Mm-hmm, mm-hmm.
Right.
Right, right. That makes a lot of sense. It basically makes the functioning of even the departments or even the mental health department. Let's talk about the mental health department, since all of these departments are a sub part of it. It even the functioning of it runs more smoothly. The patient has a better holistic, treatment given. So yeah, it makes a lot of sense that the entire team, if it comes together, all 4 or 5 individuals, they come together and they focus on that one patient, it it is going to be beneficial naturally. So
It's
now,
basically
yeah.
about who has the expertise in which
Hmm,
area, and who
hmm,
can help the patient in the best way possible. So
absolutely.
Right.
those are supposed to take care of the patient in that manner. So it's always teamwork. That is what we have been always learning since childhood also, that
Yeah. Yeah.
team is the ultimate thing. Yes.
Yeah, I
Absolutely.
completely resonate with that. So, what I wanted to ask is, now that we have talked about such an integrated approach as a team for the patient, how important do you think it is for a psychologist or a psychiatrist to know about each other, to understand each other's role better? What are you
So,
using?
over here, I would like to add that when we, as a psychiatrist, are undergoing training in our specialization, we are in depth. First of all, we work along with the psychology department. We are, in fact, posted in the psychology department. I think it's the same vice versa for the psychologist as well, that
Yes.
while they are training, they are posted in the psychiatry department where they sit with the psychiatrist. And the same way we used to sit with psychologists to see how they conduct therapy and
Mhm.
which therapy they use to help the patient. And we used to understand how basically this individual therapy is required, which one is specifically required for which kind of mental health disorder, and also understanding that how do we explain things to the patient about this. So
Correct.
over here, I think the same goes vice versa for the psychologist as well, where the psychologist, I believe, used to learn about medications and how and which cases require medications, because there are cases like psychosis or
Mm-hmm.
such illnesses where therapy does not work. So that is
Absolutely.
where they are explained about these things. Or then there are cases where there are severe depressive illnesses, where initially the patient needs to be begun with medications, and then usually it's a conjoined part with the psychology, with the therapy part and everything that works holistically for the patient to improve. um,
Absolutely.
yes.
Absolutely. Yeah, like the way you got training, like the same way we got training, we were posted in the psychiatric. Because the thing is, what people don't realize is that there are differences in the way we approach the patient. Like, for example, the case history that you all take and the case history that we all take, of course, there are lots of similarities because we are working towards mental health, but there are certain things that a psychiatrist would be more interested in. That's why he would focus on that, maybe like the physiological symptoms, and then the psychological symptoms are the things that we would be focusing on. So it wouldn't make sense that, I mean, for example, if you're the only person taking a case history and there's no psychologist on board, then who's going to look at the psychological symptoms in detail, and vice versa, right? So that the postings and working, or observing rather, is very important. Not just working together, but that observation period that should be there initially to learn more is very crucial. And I mean, I mean, I think most hospitals, most courses, most colleges and all, they should, because in the master's course, when we were doing our masters, we didn't have anything like this. It was later on when we were doing our internships and any other further higher studies courses and all, that's when we started sitting with the psychiatrists, observing, working with them. So it should be integrated a little more earlier, so that that
it's
understanding is
it's
obviously
basically that at the end of the day we all need to be on the same page, and the
there.
only
Exactly.
Yes.
way we can be on the same page is by knowing about what each of us do. And
Yes.
that is precisely why it's not that just we need to put in an extra effort to know what each of us do. It's basically in our curriculum itself. So in fact,
Absolutely.
Yeah.
I'll add on over here, as Sneha gave one personal example, that when I was getting my own specialization training, I was so enthusiastic and interested in understanding how psychology works, because as all of you really do understand that most of these psychiatric illnesses stems from the childhood, or from a psychological background where something is definitely going on, that as you all in common words say that something is going on in the back of the mind, of things like that. So
Mm-hmm.
that is what we are detectives of that. We, like how police do their investigation, we do our investigations too. I always call myself as like Sherlock Holmes, just a different kind one. So we all do our own investigation, and we all have our own way of understanding how a person is going through this difficult period.
Yeah.
So it is essential that once we know about each other, is only the way that we can understand each other and work together always, isn't it?
Yeah, and
Absolutely.
definitely that is something that is in the best interest of a patient. As in, I am sure that we all have experiences where a psychiatrist, a doctor is approached with questions that are psychological in nature, or a psychologist who's approached with medicine-related questions by the patient. And having that knowledge is definitely something that is required to be able to have a integrated approach towards this whole thing.
In
Exactly.
fact,
Right?
So,
precisely, I'll add
yeah.
one more line over here, is that there are so many patients who I hear from my very close friends who are psychologists tell me that are a little, maybe either they don't have much time with the psychiatrist, and they can't really ask about the medications or something, and they very commonly ask the psychologist about it. And then in
Exactly.
case the
Yeah.
psychologist does not answer the question in the way that patient should understood, then the patient won't be helped with that point. So in that case, again, the same thing happens with the psychiatrist too. When a psychiatrist is being asked about these questions, and if they don't answer appropriately, the patient might be misguided over here.
Absolutely. Absolutely. So, now coming to that topic, there have been instances where, because of lack of awareness, lack of education, there have been instances where the other assumes the role of, like, for example, a psychiatrist would assume the role of a psychologist would assume the role of a psychiatrist without the necessary information, without the necessary education. So what is your take on this? How is this
We
yeah.
Yes, I believe that we need to psychoeducate the patient in a manner. So I'm using this heavy word. Psychoeducate means educating the person about what the person is going through, the illness, and particularly
Yeah.
psycho is because of the part it's related to psychiatry and psychology. Psychoeducation is such a big term where it's basically educating the patient or the person who has come to you to understand about this, about psychiatry. So psycho and education in explaining the patient about the psychological and psychiatric part of what they are going through. And over here, what I usually do is that when a patient has come to me and I understand the entire illness, I take a detailed history, and as I understand that whether the patient requires medications and what kind of therapy the patient would require at that point, I explain them that therapy is not just talking or just expressing things. It's much more than that. It is a systematic way of working through the negative thoughts that you have in your mind. I won't use too heavy terms, but basically it is a very complicated process, and it is extremely essential to understand that since this has stemmed from that, we need to remove that from the root itself. And in that way, when medications are helping you do that, along with that the therapy conjointly helps that. So then
Hmm.
this is what I try to explain the patient, because if the patient is not explained properly, what the patient feels is that the doctor might is maybe just suggesting it as an alternative way or something of that sort, and then they feel that it's an option. But over here, this is the priority, that we need to explain them that if they need to get better completely, they need to understand what they need to do in the further process, and that can only happen when they have been already explained in the best manner possible. And
Right.
I believe the same way works with the psychologists that I have worked since so many such a long time. And they also, when they approach a patient, they explain in detail about what these medications do, and a lot of patients are not as comfortable asking about the side effects to the doctor rather than to the psychologist, and they ask about
Hmm.
these side effects and everything, and what does these medications do. And there are a lot of times that these medications unfortunately cause the person to feel a little sedated, a
Right.
little sleepy, and these are
Right.
the most commonly asked questions to the psychologist. So they
Right.
then again, if they have an excellent knowledge about this, where they have already learned about it, when they allay the anxiety, because the patient has already come to you in a distress, and then
Yeah.
when you don't clear that misconception from them, they are going to feel even more anxious and more disturbed. So
Right.
I think you all have had the same experience, isn't it?
Absolutely,
Yes, yes.
absolutely. So, what happens, I think what people don't realize is that, um, for example, when a patient comes to the psychiatrist, usually in hospitals, the patient comes to the psychiatrist first, and that's where the diagnosing and assessing and everything happens. And then the patient gets referred to the psychologist, and then we plan their weekly sessions or whatever session, however they want it. So they don't, people don't realize that most of the time is spent with the psychologist when it comes to the vulnerability part, like when we're talking about when the person is talking about his issues, his emotional issues and all. So since that time is spent with a psychologist more in a more personal manner, the patient feels automatically very comfortable in talking about the side effects or the other symptoms, physiological symptoms that are going on. And he shows, usually what happens is that the patient cannot distinguish between a person who has that medical background and one that doesn't, right? So we don't have a medical background, so we are not allowed to prescribe, we are not allowed to change the doses or anything, and naturally so, right? So many times the patient would ask us like, the doctor gave me these medicines yesterday, I started taking them, but I feel very drowsy, I feel very sleepy, what should I do, should I stop them? So now I am not in any place to tell him ki, no, you stop this, or you take only one tablet, you take only this amount or whatever. I can't do that. So if I know for a fact that a certain medicine, maybe an antidepressant, is going to give this person these kinds of symptoms, I can automatically say that this could be because of the medicine. Please go to your psychiatrist and ask them if there could be any changes in doses or maybe a change in medicine. This is very responsible also on a psychologist's part, because you don't have that information, you don't want to play around with a person's life, right? So yeah, I mean, I totally agree with you that being educated about each other's field and not just what the person does, but the, you know, the basics of it is very, very important, because it is a person's life and we are responsible for it. So
Absolutely.
yeah.
Exactly, spot on
Yeah.
over here. And in fact, I'll just add a small bit that that's what when as Sneha said correctly, that when the patient comes to us and we are the first people who are guiding them about what they are going through, we need to be absolutely aware of what we are telling them and how we are telling them, because that leaves an impact in them. There are so many patients who, as Sneha said, that come with doubts about medications. The patients who come to me asking that, doc, what are these therapies and why do we need to
Hmm.
really go through them? And in case we don't answer them in the appropriate manner or something, the patient feels discouraged. And this is the point where we need to emphasize on how it is important and how it is working, because a
Hmm.
lot of times patients don't realize it, but the symptoms have been improving because of the
Right.
holistic approach of the medications and the therapy together, which
Right.
Right.
either ways individually would have helped the patient, but not in the most complete manner. So
Absolutely.
equally, if both of the teams work together in a
Mhm.
single way, then only it's going to be the best outcome possible.
Yeah.
Right. Right.
As
Right.
a mental health professional, I think it is all our responsibilities to make sure that we know these things so that we
Yeah.
don't play around, right? So now
Absolutely.
that we have understood the importance of having this holistic approach, what do you think? Should it be mandatory for a patient to consult both a psychiatrist and a psychologist, like for a holistic treatment plan, or
Um,
should it be like?
Yes, so this is one of the common questions that are always again asked, and people even look it up on Google and everything. That doc, either when they approach me and they ask me, doc, should we also approach a psychologist, or when a psychologist sees a patient and they are asked that, should we also see a psychiatrist? So now that once the patient through the video has understood that they need either therapy or medication or both the things together, over here what needs to be done is that they need not compulsorily go to both. It's already difficult for the patient to consult either one. It's
Absolutely.
so difficult to come out of your fear of approaching a mental health professional. But other than that also, it is difficult because consulting is a little expensive, and patients are especially find it difficult to approach both the parties. So over here it's the responsibility of whoever is seeing the patient first to understand what the patient really needs.
Mhm.
And there can
Right.
be occasions where you might feel that there is a doubtful part where the patient might need either medications or therapy, either ways. And at that point, maybe you can ask the counterpart to maybe look at it. So over here, the concept of the mental health team is essential. And a lot of people ask me that, okay, fine, what if there is no psychologist in your own consulting, or a psychologist does not work together with a psychiatrist in the same place?
Mhm.
But then there is always a team, and when you ask the psychologist, they always are associated with a psychiatrist, or a psychiatrist is always associated with a psychologist. And when this kind of team is approached, then the patient will receive the maximum benefit, because both of them will be in communication with each other, and again, as I said, will be on the same page. So we'll be able to help the patient in the same manner. What happens a lot of time is that a patient might consult a counselor randomly. I'm using the word counselor on purpose, because they might not have something of a qualified
Yeah.
Mhm.
degree
Right.
or something.
Yeah.
And once they consult them, they are neither given the right advice nor are they treated in the right manner. Because a lot of people feel that what all we all do as mental health professionals is just tell the patient what to do. I
Mm.
believe that this is an extremely wrong concept. What we mental health
Absolutely.
professionals do is we do not stop the rain, but we just give an umbrella to the person to stop getting them wet in the rain. So
Yeah.
this is
Well
something
put.
that you all need to really understand,
Hmm.
people whoever are listening, that we guide you in the best way possible on how to come out of whatever problem is possible. We stand next to you and let you decide which fork on the road you need to go on. But at
Yeah.
the end of the day, when people do not do that adequately is when the patient suffers the distress the most.
Absolutely, absolutely. There
Yeah.
should be
Yes.
like an ideal setup. Maybe like a solution could come out of it. Even if you have your now, for example, in hospitals, they do have this ideal setup. There is that psychology department, there is a psychiatry department, there's an occupational therapy department, etc. But when it comes to private practice, which I think majority of people are in, even if they are attached to hospitals, they will have their own private practice. It's always, since we are a community, we will obviously know people from that community that we know and we trust. Like, for example, I am a psychologist, I know you, that you are a psychiatrist, I trust you. So I can easily refer my patient to you, and then after that we can, like you said, we can work together, we will be on the same page regarding the patient's treatment. So it shouldn't be like I have started something new in my therapy approach and I have not informed you about it, and it is affecting that patient's physiological symptoms in some xyz way, right? And you have absolutely no idea what the source is. That should not happen. There should be that harmony between all of these professionals so that the patient gets that appropriate treatment, which is the ideal setup.
In
So
fact, adding on to that, that's what that whenever a patient comes to me or as to Sneha or someone, and we are in communication with each other, this is the most common thing, that as soon as the patient leaves, the first thing that either of us do is that we call each other and we tell that we saw this case and these were the things that we noticed, that there was an improvement of a kind. And this is how the team works, that we know what the progress of the patient is. So the next time, for example, if Sneha has seen the patient and already told me what the patient is going through right now, and the patient comes to me, I already know what the patient is going through, and I have a basic understanding, and I can automatically guide the patient even better in the medication part, that the patient has been suffering from these side effects. So maybe I could modulate the doses, or if I see the patient and I understand that patient is feeling a little more anxious because of a particular technique of the therapy, so then I already speak with Sneha about that, and then we understand about this process in a better way, and the patient feels much more comfortable
mhm.
to get the treatment. Because as we all, as I keep saying this repeatedly, and I think this is something that I will keep on saying forever, is because the stigma of this thing is huge, and
Yeah,
one wrong misstep or approach over here can make the patient feel extremely scared of approaching anybody else in the future. So to avoid
absolutely.
that from happening, you need to understand exactly what to do when the patient approaches you from the first time itself.
Right,
Yeah.
right. And this is a really good thing, like, especially in the social media age with mental health professionals such as us and you. By the way, guys, he has his own page on Instagram called Psychiatrist Speaks. We will be linking it below. So please go and see his posts. They're amazing, especially the captions. Read them, don't miss them at all. Anyways, getting back to my point, the fact that mental health professionals are coming online, they're taking the time out of their days and they're trying to educate people without conducting workshops that is in only one setting, but like on an online
Platform.
platform where anyone from any country, from any background, from anywhere basically can access. It's very helpful. And I think, again, coming back to the topic of our video about the mental health team, through social media and through such discussions, it is much more easier for the public to get that access to this information, that there is more than the psychiatrist, there's more than the psychologist, so on and so forth.
There is the
So
umbrella, as we, yes, we say.
absolutely, the mental health umbrella, which is so important to know. But yeah, so basically, taking from all of this, the community, it starts from us, right? Everything changes from within. So I think from the community, if we change our attitudes towards each other and we become much more understanding of each other's professions and respectful also about them, there will be a greater mental health change, I feel, in my opinion. So what do you think about that? Do you think, like, we're on the way? Do you feel like we're on the way?
Absolutely, we are on the way. In fact, as I already said that I'm you all are already speaking to Sneha, who is one of Sneha and Monali, who are my part of my team where I'm already working with them. And then there are so many other psychologists who are already I am so acquainted to and so well versed to that I can just speak comfortably as soon as I see the patient, and they call me immediately in cases where they feel that Rahul, like, this is going on with the patient, and we need to work on this together and kind of thing. So this
Yeah.
way, I think already this process has begun, and most of the psychiatrists I personally know have already been practicing it. It's only about a matter of few people here and there who might not really know about this, or might be unknowingly doing this maybe. So
Mhm.
maybe for those people who, if the patients or the people approach them and they feel discouraged by it, I would say please do not be discouraged, because we over here are always remember are a team, and the team will always work towards getting you better together. And it's not going
Exactly.
to be ever a versus thing, but it's going to be an and thing where it's plus rather.
Yeah, and the
Absolutely.
advantage to
Absolutely.
this thing is if when we are working together, it is better for the mental health awareness. I mean, already we
Yes.
all are struggling with that, with the awareness, with the confusion around it, and if there is a integrated approach, then it is going to help even for us to present ourselves and for the patients or clients to approach us,
Absolutely.
right?
In fact, as
So
we all
yeah.
know that depression comes in one of the top 10 illnesses in the world itself. And while recently there was this topic of suicide also going on, this debate on what it is,
Yes.
and people don't even realize that suicide is even a bigger pandemic than the one that
Yeah.
is going on right now.
Yes.
So
Yeah.
mental health is really a priority, and we need to understand that over here, you need to really just meet with someone. Don't worry about whether it is a psychologist or a psychiatrist. Whoever you meet first is going to guide you to whoever is needed. They're not going to
Absolutely.
lay back and hinder into your treatment process. So remember,
Yes.
it's the approach that is important. Who you are approaching is a later fact, as
Yes.
long as you get the right advice and the treatment.
Absolutely. So, on that note, let's conclude this video. Rahul, again, thank you so much for coming and sharing your thoughts about this. More discussions within the community is something that we are aiming for, which you are aiming for. And like we said, it's going to be the betterment for mental health awareness. It's going to be the betterment for our community also, because it needs to grow. It needs more ethical practitioners for sure. So, we are going to be linking Rahul's profile down below in our blog. And for any other articles, any other webinars, workshops, or videos that we have made in this series, Let's Discuss, they will also be on our blog. So you can go check them out. So again, thank you so much for joining us. And thank you to the
My
audience
pleasure.
for joining us.
Thank
Without
you,
the
Rahul.
audience, obviously, we are nothing. Right?
Yes.
Okay, so let's end this here and see you all next time. Bye.
Bye.
Bye.